has been a little while since making my last video, but as you can see from the different location I have been on rural placement, which I am currently loving. Today I am doing a video based on a couple of comments that I've been having about people being a bit intimidated by the medical skills required in midwifery, about knowing what's involved in a day-to-day midwifery care, as well as how it is learning it and the science involved. So when I knew I wanted to be a midwife, I, in my head, pictured me just supporting women in labour, measuring the stomach, feeling where the baby is, doing the heartbeat, that sort of thing. But I really didn't think about the science involved as well as the medical skills required. So when I first started doing midwifery and learning about the anatomy and physiology, it was quite intimidating. So what I kind of want to explain is some of the skills required and how they can be achieved and conquered. Midwifery in Australia is 3 years, and I want to talk about kind of the skills in each year. So for me, some of the first year skills involved interpretation of blood results, doing main observations like temperature, blood pressure, that sort of thing, doing urine testing, and reviewing ultrasound reports. So this was kind of like a nice introduction into midwifery. These things were a little challenging, but they weren't too scary. I think blood pressure was something that I really worried about at first, but through lots of practice and just having confidence and trusting in what I was hearing really helped. Now, in terms of reviewing the blood results and ultrasound reports, that all came really easily because a lot of the time the reports just tell you what's wrong and how to interpret it, the normal ranges. So I didn't worry about that too much. Urine testing you learn, and that's all to do with the timing and just looking on the bottle. So again, that's nothing to worry about. When it got to second year, however, I started to freak out. One thing I was mostly terrified about was giving needles, administering drugs, and doing IVs. This terrified me. Another thing we had to do was record blood and fluid loss. We also had to do IV therapy, manage blood transfusions and blood products, insert urinary catheters, another terrifying thing for me. Do aseptic techniques with things like catheters, learn how to manage an epidural and after that's inserted, provide post-operative care, cleaning obs, be involved in cesarean section, induction of labour, so involved artificial rupture of membranes and the use of the synthetic oxytocin, as well as things like resuscitation. So my biggest thing is that all of this seems so intimidating at the start and something that I know personally gave me a lot of anxiety, but as they say, practice makes perfect, and also getting a lot of exposure to it really helped. When it came to needles, which I know is a massive thing for everyone, what helped me get over my fear was actually giving myself a needle. We had a really cool lecturer who said, as long as you're using the proper technique, not putting anything in the needle, not pushing air through, I'll let you do it on yourself. So I just used like a little intramuscular needle, what they use for insulin and also the baby needles, and it didn't hurt at all. And the fact that I could do it on myself gave me confidence that I could do it on other people. But what else also gave me confidence was just practicing on fruit. The first time it was a little stressful, but then again, now it's nothing, and before I was literally losing sleep over it. Also, IV therapy, the pumps and the tubes and everything looks so intimidating, but just asking your midwife, hey, could we go through this, and taking the time to watch it carefully, you'll know that it is quite simple, and as long as you're following procedure and policy, you get the hang of it and it ends up being okay. Third year, some of the skills we had to do were to do with a lot of complex issues. So it's looking at like hypertension, diabetes. It was also managing premature rupture of membranes and preterm labor, and one of the most intimidating, assisting in emergency situations such as postpartum hemorrhage and shoulder dystocia. So whilst these skills do appear really frightening and are stressful, if you just get that theoretical background down, it can give you a lot more confidence. And also when you first start reading about it, you think, I'm never going to remember this, not in an emergency, not when I have to do it. But honestly, it all slowly starts to fold together, and you've just got to trust yourself and just ask for help when you need it. Find midwives who are mentors. And the way I like to justify it is that instead of just being able to deliver those kind of emotional midwifery skills of support and the happy bits, you can also be there in a holistic approach of being able to take care of all their medical things, which lessens anxiety for them, and having that same caregiver really helps. So So ultimately what I'm wanting to say is, if these skills do seem intimidating to you and maybe you're putting off doing midwifery because you don't think you'll be able to, I just want you to know that it will take time, and it is scary at first, but it does all come together and you really do start getting a strong confidence for it. I compare it to when I started to drive. I absolutely hated it. I used to like have heart palpitations while I was driving and my hands clenched on the steering wheel, but now that I've been driving for 3 years, I feel very confident. You know, I can do it and completely relax. So if you compare it to something like that, of course, when you start new things, it's hard, but the more practice you have, the better it will be. So hopefully that helps some of you who are wanting that information. If you have any other video requests, leave it below and I will try get to making it. Thank you so much for watching, and I'll see you next time.